All right, I think we can kick off and hopefully a few more people will join us as we go. So welcome everybody to today's call with a focus on adaptation and part of the global engagement course in climate and health. And we hope that it will be really useful to delve into a little bit more detail on adaptation, how it in UNFCCC, and also some maybe potentially less well understood issues within adaptation, and to talk about the ways in which climate change impacts different areas of human health. We'll be focusing on neglected tropical diseases and mental health within that today. And we'd love also a little bit later in the agenda to hear your thoughts on how adaptation relates to your own work. So if we move to the agenda slide. Thanks, Belena. We'll kick off with an overview of health and climate change adaptation. And for that, we'll be hearing from Milena from GCHA. We'll move into a deeper dive on some key adaptation priority areas. So we'll hear from Dr. Fiona Charlson on mental health, and then from Ritika Datta on neglected tropical diseases. We'll pause for Q&A and discussion, and we'd really love to hear, if folks are working on something in particular in relation to adaptation right now, or if there are particular measures that you think need to be prioritized. Fiona and Ritika will already have covered some of those, and it would be great to expand on that list. Then we'll hear again from Milena to give us a bit of an introduction to how health and adaptation feature in existing UNFCCC processes, and then I'll take us on a bit of a deeper dive into one of those processes, which is the global goal on adaptation, and what some of our thinking is around that, and what the opportunities and next steps look like. And then again, we'll pause for Q&A and discussion when we get to that point. So right now, I'll pass over to Milena to give us that overview. And if folks want to introduce themselves in the chat, that would be wonderful. And also to mention that this meeting has simultaneous interpretation. You can enable it by clicking on the icon at the bottom of your screen. Some of the Zoom things have moved around a bit, so let us know if you have any problems. And also a request to speakers, if you're able to speak slowly to help the translators, that would be wonderful. And now I'll pass to Milena. Thank you so much, Milena.
Thank you, Jess. And welcome from me to everyone too. I'll repeat the announcement on the simultaneous interpretation in case there are some Spanish speakers. Tenemos disponible interpretación simultánea al español. La pueden activar desde el botón Thank you. All right, so diving into adaptation and climate change and health. So climate change, as you already know, poses significant challenges to human health. All over the world, populations are suffering the impacts right now, and impacts are expected to intensify in the coming decades. The current efforts of mitigating climate change to the goal of the Paris Agreement are insufficient, and we're heading into a future of 2.7 degrees Celsius of global warming with the current policies in place. So as global temperatures rise, extreme weather events, shifts in disease patterns, and threats to food and water security are becoming more frequent and severe. In this context, climate change adaptation plays a crucial role in safeguarding public health. And what is adaptation as climate action? It is
Milena, I'm really sorry to interrupt you, but your slide hasn't changed for me yet. Is anyone else having that challenge?
That's right. Thank you.
Thank you.
So, what is adaptation? modifying natural or human systems, processes, practices, and structures in response to actual or expected climatic stimuli or their effects. The goal of adaptation is to reduce the harm caused by climate change and to leverage any opportunities that it might present. In simple terms, it is that countries and communities need to develop adaptation solutions and implement actions to respond to the current and future climate change impacts. And adaptation actions can take on many forms depending on the unique context of the community, country, or region. There is no one-size-fits-all solution. Adaptation can range from building flood defenses, setting up early warning systems, switching to drought-resistant crops in agriculture, or redesigning communication systems or actions in business. These actions are laid out in national adaptation plans, sectoral adaptation plans, and local action plans. And health can be also considered as a pillar of adaptation. Populations that have good health are more likely to withstand and recover from climate shocks. We can describe this as health resilience. So effective adaptation measures must prioritize protecting and enhancing public health to ensure communities are better equipped to cope with. Sorry, David, can you please mute yourself? Thank you. So that communities are better equipped to cope with and thrive in the context of climate challenges. Incorporating health considerations into broader climate policies across sectors, including agriculture, water management, and disaster preparedness, ensures a holistic approach to public health protection. And not including health experts and health considerations in general in adaptation planning can miss crucial actions to protect population health and can result in policies and programs in other sectors that inadvertently cause or contribute to health impacts and also may undermine efforts to protect the environment. And to expand a little bit on different sectoral approaches. So health as an outcome of adaptation across sectors is also a key consideration. Let's take resilient health systems. If we build robust health systems capable of responding to climate-related health emergencies, including improving infrastructure, training healthcare workers, and ensuring equitable access to healthcare and access to necessary medical supplies and treatments, we make our populations more resilient. With early warning systems, developing and deploying early warning systems for extreme weather events and outbreaks of climate-sensitive diseases, we mitigate climate impacts by enabling timely public health response. And if we look at urban planning and infrastructure, designing climate-resilient infrastructure such as improved water and sanitation, green spaces, safe and resilient buildings, access to reliable clean energy and technology. We can provide access to active transport, which brings good health. We can mitigate heat, flood, air, and water pollution exposure, and reduce health risks. And in resilient agriculture, with improved nutrition security and sustainable agriculture practices. We promote safer, healthier food production, and we reduce exposure to harmful chemicals in the food supply. So another important consideration is throughout different sectoral adaptation measures, the implementation of community-based approaches comes in response to the versatility of circumstances and vulnerabilities. Community-based approaches are, for example, including local communities in adaptation planning, consulting them on what are their specific necessities and vulnerabilities, and also public education campaigns on preparedness or vector control. So engaging local communities in adaptation planning ensures that strategies are culturally appropriate and more effective while tackling specific vulnerabilities. And thus health is, to some extent, an outcome of adaptation across sectors. And with this overview, I would like to turn to Jess to present our guest speakers. Thank you.
Thank you, Milena. Fiona is going to share her own slides, so you are able to stop for now if that works for you. And we're really, really delighted to have Dr. Fiona Charlson with us today. Fiona is Associate Professor at the University of Queensland Centre for Mental Health Research. She founded and leads the world's first mental health and climate change transdisciplinary research network, and is at the forefront of efforts to understand and address the mental health impacts of climate change. Fiona, over to you.
Okay, just checking everybody can see my slides okay.
Perfectly, thank you so much.
Okay, that's great. Thanks, Jess, for the invitation today and for introducing me. It's a pleasure to be here and to talk about a topic that is perhaps just emerging as within people's awareness in terms of the impacts of climate change and how far-reaching those impacts are. I'm at the Queensland Centre for Mental Health Research and the University of Queensland, and I lead a research network across Australia, which extends into other areas of Oceania, and our research is quite transdisciplinary. So I'm just going to present today a little bit about what the mental health impacts of climate change are according to the literature, and then I'll go in and talk very briefly about some policy gaps and some opportunities. So we know from the literature that climate change related events are associated with a wide spectrum of mental health and well-being outcomes. However, compared with other health areas, social and emotional well-being or mental health and well-being and climate change has received very little research attention, particularly in the context of rural and regional communities and low and middle income countries, who are the ones most directly impacted most of the time. I want to present this image, which is from a paper by Helen Berry back in 2018. And it's a hypothetical model or visualization of how complex the relationships within mental health and climate change system, if you like, are. They've hypothesized from the literature, they've hypothesized this broad range of factors and really complex pathways of factors across the whole of society. So we've got social factors, economic factors, biological factors, some political factors, environmental factors that all sort of interact in a very complex way to impact the mental health and well-being of populations. We also know, because of this complexity, that the impacts, the mental health impacts are multi-level and they're cumulative as well. So we've got these primary impacts, which we probably think about quite quickly, immediately. They include heat, rainfall, floods, fires, and storms. And then we have these secondary, which are a little bit more indirect impacts, a bit more slow and chronic creeping impacts, such as drought, sea level rise, land degradation, air pollution, physical health, and water and food security. But what is even more important than these primary and secondary impacts are what we call tertiary impacts. These occur across society as a result of climate change and have been shown to have associations with mental health. And these are displacement and migration and a loss of connection to land, health system pressures and reduced access to mental health care, reduced economic productivity, agricultural losses, reduced financial security, strain on community cohesion and social capital, and loss of nature spaces and connection to nature, and also conflict and political instability. Of course, there are probably a number of other factors, impacts going on that we just don't know about yet, but that is what the literature is telling us at the moment. In terms of the spectrum of mental health impacts, we have seen climate change impact on a range of mental health outcomes, from psychological distress through to clinical disorders, exacerbation of pre-existing illness, mental illness. We have seen in the literature increased psychiatric-related hospitalizations and deaths. And there's also this cluster of environmental and climate-specific constructs, such as climate anxiety, solastalgia, and eco-grief, to name a few. And an area that is really unexplored but could be quite important are the potential neurodevelopmental impacts on the developing brain of babies and young children. We also know from the literature that climate change is having an impact on service demand. Emergency visits and hospitalizations are increasing during hot weather, and also extreme weather, other extreme weather events. Suicide is elevated, and we're really expecting to have an increased use of healthcare facilities as the climate crisis unfolds and progresses. So we really do need some planning. And the WHO has noted that adaptation in the context of health involves strengthening the climate resilience of health systems, where mental health should be integrated within this approach to build resilient mental health systems. So there needs to be a focus on strengthening formal health services, but there are also a number of effective psychosocial interventions which can be delivered by non-specialist health workers and trained community members that might be suitable in the context of climate change. And I will add a caveat there that whilst these interventions have been used widely and shown to be very effective, they haven't yet been tested in communities that are deeply impacted by climate change, and that is a research need. I also want to note that climate change is a collective experience for the most part, and it might be another area for research to explore whether the focus on individualised clinical support is really the best way to support communities who are being deeply impacted by climate change. I just want to explore mental health as it's really a cross-cutting issue, which is more so for mental health perhaps than for other health outcomes. The complex pathways that I alluded to in the figure earlier between climate change and mental health are made up of biological, social, political, economic and environmental factors, and it really makes it a cross-cutting issue across all of those domains. It's not just a health issue. And if we don't acknowledge that complexity and that cross-cutting nature, we really might be missing opportunities to provide effective mental health responses. And it might be that those mental health responses lie outside of the health system, which is really important for us to try and understand, because it could potentially reduce expenditure on expensive interventions in clinical settings. And it really actually might be more effective than solely relying on clinical services. But we do need new research to fully understand this. So I just also want to talk about policy briefly. So mental health is broadly omitted from climate change and health policy and decision-making mechanisms currently. It's a little bit old now, but in 2018, the Lancet Countdown report noted that out of the 16 national health adaptation strategies they reviewed, only 5 mentioned mental health, and mental health was the least considered climate-sensitive health outcome in that assessment. So there's a lot of room for improvement there when it comes to mental health in policy. WHO's mental health and climate change policy brief that was published in 2022 recommends that climate change should be included as an important determinant of outcomes in all health and mental health related policies, which makes sense because that's WHO's mandate. But I would also advocate that because of this cross-cutting nature of mental health, I would advocate for a climate and mental health in all policies approach across social policy, across economic policy, across energy policy. And I'll just briefly talk about one policy area, which is disaster management, that needs a little bit of a shift, quite a large shift perhaps, in the context of climate change, because mental health support has traditionally been helicoptered or dropped into post-disaster response and recovery with very little focus on preparedness. But these existing reactive and short-term responses include frequent implied and direct reference to this concept of recovery. But this concept of recovery in the context of climate change is problematic because it conceives of extreme weather events as single one-off occurrences, which they're no longer not. We're seeing compounding events. It also implies that they're unexpected in nature when that's not the case anymore. We expect these events more and more in terms of frequency and magnitude. And it's also problematic because it contains an integral assumption of an endpoint where individuals or communities are recovered back to a place of where they were before, which is maybe unrealistic and setting us up to fail. So we're proposing that models of mental health and wellbeing support, including those funding models, which support them, need to change, shifting away from recovery towards a focus on preparedness and adaptation. So that's just one policy area where there's some ideas for a shift. I just wanted to finish on some considerations perhaps for integrating mental health into climate adaptation policy and activities. And these are just my ideas, and they're not, it's certainly not an exhaustive list, but there's certainly some things for consideration. And these include to develop and implement education and awareness raising about mental health and climate change among policymakers and healthcare professionals, to embed mental health in climate vulnerability and adaptation assessments, plans and policy, because it's currently overlooked, to develop an evidence-based mental health and climate change adaptation plan, which expands beyond the formal health system and includes community-based approaches. One could create a roadmap for how mental health will be equitably embedded within all health and climate initiatives, including, for example, appropriate representation on reference groups and advisory committees. Could establish interdisciplinary and intergovernmental collaborative bodies which are able to address the cross-sectoral nature of mental health. There's a need to map and evaluate mental health interventions that are being implemented in the context or in climate change impacted communities, and this can provide decision makers and communities with more information and better guidance. Surveillance and monitoring of the mental health impacts of climate change is very poor at the moment, so that could be a focus. And finally, investing in research to equip decision makers with a better understanding of where and how to invest in mental health infrastructure and resources. And that's it from me. Thank you. That QR code can take you to our website, and there are some contact information for me there.
Thank you so much, Fiona. It's absolutely true that we're not seeing nearly enough focus on mental health, either in the climate space, the climate and health space, or the UNFCCC space specifically. It's really encouraging that there has been an increased attention to mental health in the most recent IPCC impact report, and we're starting to see mental health come through in the UNFCCC negotiations a little bit. So in the COP preparatory meeting that took place in Bonn in Germany back in June, there was an intervention from Palau talking about the impacts of climate change on mental health in small and developing states and how that's leading to substance abuse. But we don't just need more mentions, we need more actions. And it was so helpful of you to spell things out so comprehensively and to think through what we need to be advocating for, but also when governments do mention their interest in mental health, that we can be ready to suggest which interventions work. We're going to hear now from Ritika Datta, and then we'll pause for questions after that to Fiona and or to Ritika. So Ritika is Policy Advocacy Manager with the Drugs for Neglected Diseases Initiative, DNDI. She's been spearheading much of DNDI's work on climate change and is really at the forefront of thinking about how measures to address these diseases should be accounted for in the UNFCCC goal on adaptation that we'll hear about later too. But first, to make sure that we've all got a comprehensive grounding, over to you, Ritika, to walk us through what we need to know. Thank you.
Thank you, Jess. Hi, everybody. As I just said, I'm Ritika, and I'm the Policy Advocacy Manager at Drugs for Neglected Diseases Initiative. Next slide, please. So just to give you a brief overview of what my organization does. So we are a nonprofit research and development organization that develops and delivers drugs for neglected diseases and neglected populations. So we have offices all over the world, in Geneva, 3 offices in Asia, a couple of offices in Africa, and in the LATAM region as well. Next slide, please. So just would like to share a brief overview of what our organization's 4-pronged approach to climate and health is. So the first bit is we look at, we develop treatments for climate-sensitive diseases that predominantly affect populations in the LMICs. So among the diseases in our portfolio, we have around 6 climate-sensitive vector-borne diseases that we look at. For the second bit, we also we advocate for medical innovation for climate-sensitive diseases in the climate change adaptation response. We also made a commitment last year to reduce our carbon emissions by half. And since we are an R&D organization, we also are looking at approaches on how to green R&D and manufacturing systems. Next slide, please. So coming to NTDs or neglected tropical diseases. So what are they? So they are a diverse group of 20 diseases that affect around 1.6 billion people worldwide, and mostly they affect impoverished and vulnerable communities. And several of these NTDs are climate sensitive. So of the NTDs that are listed by WHO, nearly half of them are vector-borne or waterborne and are likely to be impacted by climate change. So the way it would be impacted by climate change, of course, effects will be varied, but climate change could lead to increased disease transmission, as we're seeing with dengue in many countries. It could lead to expanded geographical range of the disease. So, for example, dengue, which was non-endemic in a couple of the regions, like say in Europe or Japan, in America, it's now spreading to those regions, and that is a result of climate change, urbanization, and a lot of other factors as well. It could lead to an increased risk of epidemics, and in some cases, climate change might also increase the severity of diseases. And overall, it could lead to compounding existing health inequities. Next slide, please. So let's take the example of dengue, which is listed as an NTD by WHO. So there are factors which would lead to an increased spread or an increase in incidence of the disease. But some of these factors may also lead to limiting the disease spread or the incidence. For example, increased temperature might lead to an increased development rate of vectors or increase the biting frequency. But in some cases, if the temperature crosses that threshold, then it might also lead to a reduced vector growth or survival rate. Increased rainfall would lead to creation of new habitats for the mosquitoes, which primarily transmit dengue. But if there's heavy rainfall and if there is heavy water flow due to flooding, then it might also eliminate vector habitats. A reduced rainfall would mean that people would start storing waters, and that could lead to creation of new habitats which are suitable for dengue vectors. And in some cases, it may also lead to destruction of vector eggs. And a combination of increased rainfall and temperature may lead to an extended period for dengue growth, for dengue spread. And rising sea levels would also lead to creation of more favorable vectors for dengue. Next slide, please. So we can see that as a result of climate change, for dengue now, there's prolonged period of suitable disease transmission. For example, if you consider the countries in South Asia or Southeast Asia, dengue was limited to the monsoon seasons, but now you can actually see year-round outbreaks. So this is something very concerning for countries which already have fragile or overburdened health systems. Latitudinal and altitudinal expansion. So as I said before, dengue is now spreading to non-endemic countries. And of course, this has led to a lot of attention on dengue, particularly globally. Increase in trade, population growth, movement, changing land use, and rapid urbanization are also some of the other factors which are leading to increasing dengue spread and transmission. And as per the latest data, dengue is now endemic in more than 100 countries, with regions in Latin America, Southeast Asia, and Western Pacific being mostly affected. And dengue-related deaths have increased as well by 27% in 2022 when compared to 2016. And the latest report by Lancet Countdown on Climate Change and Health has predicted that if it continues at the current rate of temperature rise, then the transmission potential of dengue will increase by 36 to 37% by 2050. Next slide, please. So here are some of the other examples of how climate change will impact NTDs, particularly for those diseases that are in our portfolio. And it is anticipated that many of the NTDs which are climate sensitive will see changes in their transmission periods, in their patterns, in their geographical range. And populations which has been previously unaffected by diseases might be at risk of these diseases in the future as well. For example, for schistosomiasis, the Eastern African region might see a 20% increase in the next 20 to 50 years. Chagas, which is endemic in some of the countries in the Americas, might see a change in distribution and an increase in transmission, although it is predicted that it's going to vary geographically throughout the region. Then there's another climate-sensitive disease, leishmaniasis, which is caused by sandflies, and one of the studies suggests that the number of individuals who are at risk of leishmaniasis may double by 2080 as a result of climate change. And displaced people because of extreme weather events like flooding and famine may also expose more and more people to the risk of leishmaniasis transmission. In case of sleeping sickness, we can see that higher altitudes such as the Kenyan Islands may see an increased risk. And also climate change, deforestation, population growth, and urbanization would also increase human-snake contact and increase the risk of snake bites as well. Next slide, please. So very recently, a couple of months back, WHO with a few other authors led a scoping review on which studied the effects of climate change on malaria and 20 NTDs. DNDi contributed to this paper as well. So the review looked at over 500 papers, and most of them studied malaria, dengue, and chikungunya, and a few papers studied leishmaniasis, but the other NTDs were relatively neglected and understudied in literature. So this is an interesting paper to read if anyone's interested, and I've included the link in the presentation as well. And it tells us that, the impact of climate change will, of course, be disproportionately borne by the poorest and the most vulnerable people. And these are the people which are also mostly affected by malaria and neglected tropical diseases. And this paper shows or highlights that for many of the NTDs, there are still gaps in knowledge on how climate change may impact transmission. As you can see, most of the papers studied malaria, dengue, chikungunya, and leishmaniasis only. The other NTDs were relatively understudied. But from the existing data, it can be inferred that climate change will have direct and indirect impacts on the transmission of dengue, malaria, chikungunya, and leishmaniasis. and other vector-borne diseases as well, although the amplitude of the effect or the direction of the impact, like whether it will lead to an increase or a decrease in disease incidence, still needs to be studied, and it's still not clear. And importantly, NTDs are likely to be given very limited attention in the climate change discussion space, including in the IPCC assessment reports. And what is required now is a better understanding of how climate change would impact NTD transmission dynamics for us to be able to be prepared better. Next slide, please. So what is the challenge for us now? So as we've seen that climate change will may lead to a rise in vector-borne and waterborne infectious diseases, would lead to new emerging diseases, and also lead to climate-related migration. So this compounded with the fact that the impacts of climate change will be disproportionately borne by vulnerable populations in the global south, and the existing biomedical R&D system is not responsive to the needs of low resource settings. And this leads to a looming crisis of innovation and access. Next slide, please. So very quickly, I will explain what the innovation and the access gap is. So, of course, as Milena explained in her presentation, that there is a increased need for disease surveillance, for early warning systems, for vaccines, for virus testing, and for vector control as well. Now, all the preventive measures are, of course, very important, but this will not suffice because populations are already seeing the impact of the rise in these diseases in countries of the global south. And what is required now is adaptation responses to respond to the urgency that is faced by populations now. So the prevailing for-profit model of medical research leaves very little incentive to develop drugs for NTDs, which primarily affect the poorest and the vulnerable communities. And because of this, for many of the NTDs, there are still no tools, there are still no diagnostics or no treatments that are available that would be simple, safe, and effective, and which can be easily integrated into the existing overburdened healthcare systems. Like, for example, for dengue, there is no specific treatment available yet. So the treatment for dengue is supportive care. And for a couple of other NTDs that I have spoken about previously, the treatments that exist today are either toxic, or some of them require prolonged hospital stays with intravenous injections. So it's really complex, and these diseases continue to affect so many people around the world. So what is the access gap? So despite global spread in some of these diseases, countries in the global south continue to bear the burden due to the impact of climate change on infectious diseases. And now we can see that spread of climate-sensitive diseases to more higher income countries may lead to more focus on innovation for health tools. However, as we've seen during COVID, that innovation may not necessarily guarantee or lead to equitable access to those tools by the people who need them the most and who are most affected. And also, it does not guarantee that those diseases which predominantly affect the lower middle income countries would be prioritized in the innovation space. Next slide, please. So, very recently, we've seen that there is increased acknowledgement of the impact of climate change on infectious diseases in particular. And these discussions have cropped up not only in the adaptation space, but also in mitigation. And recently at the Climate and Health Resolution, which was adopted at the WHO this year, there is a commitment by member states to promote research and development to detect, test, prevent, and treat and respond to climate-sensitive diseases, which is great. So this sort of sets a precedent for countries to act on climate-sensitive diseases. But here's a set of other policy actions which we could take for addressing the rise in climate-sensitive diseases. So the first one is ensuring that development and the deployment of new tools are a key component of climate adaptation discussions and strategies. And ensuring that indicators for climate-sensitive diseases are considered in the Global Goal on Adaptation framework, which is being already being discussed and set into motion. And indicators will be finalized by COP30, which is next year. So we are hoping that expert groups and countries do push for indicators on climate-sensitive diseases as a part of this framework. Ensure that response to climate-sensitive diseases is included in the Global Plan of Action, which is being currently developed by WHO as a sort of implementation plan of the climate and health resolution. And all endemic countries should include plans to respond to climate-sensitive diseases in their national adaptation plans. And the other point would be to support South-South collaborations where, the countries facing the greatest burden and the most affected by climate change are actually the ones who lead the innovation agenda rather than the other way around. And that's about it for me. Next slide. Yeah. So if you have any questions, I'm happy to respond to them later. Thanks, Jess.
Thanks ever so much, Ritika, and especially for sharing those projections about how different NTDs are likely to increase in years to come. I think so often we can assume that healthcare and action to address these diseases are really, really advancing, but that's clear that that's currently being outstripped by the rate at which climate change is progressing. And yeah, thanks for highlighting the access gap issue too. We're going to take a few minutes now for Q&A and discussion. We'll probably run 10 minutes past the top of the hour with the presentations from Milena and I that we have after the Q&A and discussion. If you need to drop off at the top of the hour, absolutely no worries. We will be sharing a recording, so you'll be able to get the information after. But would anyone like to already come in with questions to Fiona or to Ritika? Or to share some of your own work on adaptation and what measures are needed to address the health issues that you work on. If no one wants to kick off, I've got a question that I'd love to pose to Fiona and Ritika in whichever order you'd like to come in. And knowing, of course, that appropriate adaptation measures really differ depending on the context that they are implemented in, but whether there is anything being done on mental health or neglected tropical diseases that you feel is noteworthy and worthy of amplification in terms of solutions. Thank you.
I'm happy to go first. The sad truth in the mental health space is that we just don't have enough research actually looking at mental health interventions in the context of climate change to be able to confidently identify which interventions we would recommend from an evidence-based perspective. There's lots of opportunity for existing interventions to be trialled in communities impacted by climate change, which would be a very low cost exercise. It's possible actually that these interventions are already being delivered, but they're not being evaluated, or they're not being partnered with research teams that are able to sort of contribute and collaborate in terms of knowledge dissemination as well. So that was one of the points I made in the, sort of things to consider if in people's countries they were able to partner with a research group, or even, it doesn't have to be in a sort of elaborate way, but to sort of map and evaluate broadly what interventions are being delivered. I think that would be an incredible contribution to the research space at the moment.
Thanks so much.
Yeah. So actually, a lot of countries have included responding to climate-sensitive diseases in their national adaptation plans. Now, as you know, implementation and development of those plans take time, and there's also the need for finance linked to it. And countries have spoken about developing surveillance systems, which also include surveillance for these climate-sensitive diseases. They've put in stuff around developing early warning systems, which would help them in detection and outbreak response. But the problem is, some of these diseases are already affecting these populations. So some of these measures need to already be in place, and you already need tools to start responding to some of these impacts. So that has not been highlighted in the adaptation plans of many of the countries. So that's a gap. The other thing is, there needs to be more research around how climate change will exactly impact some of these infectious diseases, right? And it could vary according to regions, according to countries, national context. So it is not necessary that all climate-sensitive diseases will be important for all of the countries. So I think countries need to kind of select which of these diseases are of relevance to them and needs to be addressed. And also there needs to be further research on the impacts of climate change on these diseases. And the other thing which needs to be strengthened is data collection. So in a lot of these countries, particularly I think in the global south, the data is still not of sufficient quality. It's still poor quality data. So I think data for these climate-sensitive diseases needs to be integrated into the routine collection efforts, and also be integrated into the HMI systems of several of these countries, for them to be able to just track better what's happening, and then also to kind of drum up response strategies. Yeah.
Thank you, Ritika, and also just to note the appreciation in the chat for both yours and Fiona's presentations today. I'm so glad that we could fill some, not often spoken enough about gaps. Would anyone like to ask additional questions to Fiona or to Ritika, or to share what sort of adaptation measures are needed for the health issues that you're working on? If you're more comfortable doing that in the chat, please feel free to do that too. Charlotte, please come in.
Okay, thank you very much. And I don't think I have a question, more like observations and probably sharing some experiences. So I'm Charlotte Boo, and I'm a public health specialist from Cameroon, but I work with the Geneva Learning Foundation. And a lot of the work we do is with frontline health workers from the Global South. That we have a network of health workers from all system levels and organizational affiliations that come together to share experiences and learn from one another about public health challenges that they face. And we usually organize events, those experience sharing and peer learning events. And so last year we did a kind of survey in which we asked about 4,500 health workers if climate change was a challenge for the communities they served. And the staggering result was that for many of them, they said they are observing the dire impacts on the climate, on the impacts of climate change on the health of their communities. And many of them are already like taking action to address these, but those are usually personal initiatives. And a few people talked about the impacts of mental health, but many more talked about the impact of climate change on neglected tropical diseases. And what we observed is during interactions, so many practitioners came back to say they don't know a lot of the neglected tropical diseases. So the real issue is interventions that are not public health priorities in, like I said in the chat, in different countries or in different contexts. It will be difficult for people to know exactly what to do if those are being exacerbated by climate change. for instance, lots of people reporting back about increase in the cases of schistosomiasis, and notably female genital schistosomiasis, that's a neglected tropical diseases. And number one, they're not even knowing how to treat those. And then number two, the availability of the drugs that are used. So there is, I think, there is a necessity maybe to go back to the drawing board and look at how, like Milena talked about, the early warning system and the surveillance is important, but really even at the level of the training from the professional schools, already integrating climate change and health and its impact in the training programs, and looking at the potentially the different diseases, especially the infectious diseases that are affected by this. So these are really top. I have probably have a lot to share. One other thing that I wanted to talk about, a few months back, I went to my village to visit my father, and he had a eucalyptus forest, and he was telling me the forest is dwindling and he's getting. So I just got him to engage, to make an engagement that for each tree that is felled, he will replant 2 or 3. That way, that could be his contribution to the environment, and also to share that with his friends.
Thanks so much for sharing, Charlotte. Noting that we are almost at the top of the hour, I'll just take the opportunity to thank our speakers one more time. Really so grateful to you, Ritika and Fiona, for sharing your expertise today. Milena and I will take another 10 minutes to run through UNFCCC processes, but fully appreciate that people may need to drop off now, and so grateful for everyone's time and for joining today. Milena, would you like to pick back up? Thank you.
Thank you, Jess. So I will run quickly through an introduction to the spaces and the different instruments, planning instruments that are used in the UNFCCC space. So first, of course, we have the national adaptation plans, which is a process that enables parties to formulate and implement national strategies to reduce vulnerability to the impacts of climate change and build adaptive capacity and resilience. Most of the national adaptation plans, as analyzed by the World Health Organization, have the health sector as a priority and also include health interventions. And then let's focus on the health national adaptation plans. These are developed by the Ministries of Health as part of the national adaptation plan process. They outline actions to build climate resilient health systems and are critical for ensuring the prioritization of actions to address the health impacts of climate change at all levels of planning, and for linking the health sector to national and international climate change agendas, so to maximize health co-benefits of mitigation and adaptation actions in other sectors. And in order to adequately respond to the impacts of climate change on the health of the population and on the health system, a first critical step is to assess which populations and geographical areas are most vulnerable to the different kinds of health impacts. So this is done by the vulnerability and adaptation assessments. I'd like to say that there are many useful reports at the WHO website for those of you who would like to learn more and maybe engage in your country's processes. Now I'd like to talk about the UNFCCC bodies working on adaptation. So maybe the oldest one is the Least Developed Countries Expert Group. It was established to provide technical guidance and support the least developed countries on the process to formulate and implement national adaptation plans. and also an essential technical guidance on accessing funding from the Green Climate Fund for their adaptation plans. Then there is the Adaptation Committee that is offering guidance to all parties to prepare their adaptation communications, which is another document where countries can lay out their actions and their information on their vulnerability to climate change. It is submitted at a biennial basis. And then we have the Nairobi Work Program. This is the UNFCCC Knowledge to Action Hub for Climate Adaptation and Resilience. It is a network of over 400 organizations committing to closing the knowledge gaps and scaling up climate adaptation actions in countries. So you can check out the Adaptation Knowledge Portal and see there different organizations and universities from around the world share their research on adaptation, on planning, and this is the idea. And maybe you can make links with your country's universities to also contribute to closing the knowledge gap on adaptation. And then just a brief introduction to what's the most exciting in the moment process in the UNFCCC on adaptation, and it's the global goal on adaptation. It is an internationally agreed objective under the Paris Agreement to enhance adaptive capacity, strengthen resilience, and reduce vulnerability to climate change, with the aim of protecting people, livelihoods, and ecosystems worldwide. It was established to provide a collective vision and direction for the international community to engage in needed adaptation and resilience building efforts. In CMA 4 in Egypt, the development of the framework that allows us to measure the progress towards the global goal on adaptation and its targets started. And in the UAE, parties adopted the framework. Jess will expand more about how health features in the GGA and how the health community is assessing its importance. Over to you, Jess.
Thank you, Milena, not just for presenting, but for being so lucid just after midnight in Chile. I'll be quick. Could we skip already to the next slide? Thank you. So to pick up where Milena left off, just to give an understanding of where we're up to in the process on the global goal on adaptation. As she said, it's mentioned in the Paris Agreement in 2015. Everyone then promptly forgot about it for about 7 years because adaptation is much harder to quantify and track than mitigation, which is also such a key part of the Paris Agreement. So for mitigation, you can count emissions. For adaptation, what's needed looks so different in different parts of the world. And it's much harder to measure whether or not we're making progress towards it. Finally, in 2021, governments decided that it would be great to pick up this discussion on the global goal on adaptation, and they set up a 2-year work program to define what the GGA might mean in practice. They were due to identify targets and indicators by the time we got to COP28 in December in 2023. We only made it to targets, but at least that's still some level of progress. So now for the next 2 years until 2025 at COP30, there's another work program where we'll look at what the indicators under those targets actually look like. Next slide, please. So how does health show up in the global goal on adaptation? If you're interested in the details, then there is a link to the UNFCCC document that will be accessible once the slides are circulated. But well-being is already encapsulated in the overarching framing of what the global goal on adaptation is. It talks about the collective well-being of all people. Then in paragraph 9 of that decision, we've got different thematic targets. So there's a dedicated one on health that you can see in the bottom left of the figure. Attaining resilience against climate change related health impacts, promoting climate resilient health services, and significantly reducing climate related morbidity and mortality, especially in the most vulnerable communities. There are health relevant words that are used in the food and agriculture target. At the top of the figure, there's a reference to adequate food and nutrition for all, so also about the quality of the food as well as the quantity of it. And then in the water target at the bottom right of the page, there's a reference to potable water for all, so really emphasis on whether or not that water is drinking quality. But then, of course, all of those other targets on the page are also relevant for health. If we don't have strong infrastructure, if we don't have protected ecosystems and biodiversity, then we're not going to have good health outcomes either. Same for poverty and for cultural heritage. And then there's also a paragraph 10 that although health is not explicit in the targets that are contained in paragraph 10, they relate to the adaptation cycle. So impact, vulnerability and risk assessments, planning, implementation, monitoring, evaluation and learning. These nonetheless relate to what Milena already covered in terms of vulnerability and adaptation assessments, and these were brought up earlier. In addition, I'm really thinking of health in terms of how we monitor the outcomes and build on learnings and make sure that health ministries are brought in planning and implementation. Next slide, please. We can skip that one. Thank you. So what makes a good global goal on adaptation indicator? This is very much a wish list. I think it's actually impossible right now to develop indicators that meet all of these criteria, but this is what we'd like to work towards. A good GGA indicator would be outcome focused, so not just mentioning whether an action has been completed, but really what the implications of that action are. It should be climate informed and really tied as specifically as we can to climate change. We know that often climate change is one of multiple factors that is influencing health and disease outcomes. It should be evidence-based, which links a little bit to the previous point, like can we prove the climate link and where the adaptation action is being made. It shouldn't mask inequalities. So this links back to Ritika's point on access. Just because something's being done doesn't mean that it's necessarily reaching everybody. It should draw on existing monitoring and not create an additional reporting burden. We know that particularly in many countries in the global south, there's already such a high burden of monitoring and producing quality data. We want to avoid potential maladaptation. Generally, climate adaptation measures are going to be beneficial for health, but depending on the exact framing of them, there are ways in which they could harm health. So really making sure that health is at the forefront of what those indicators look like across those themes. It should be relevant at both global and national levels. So really tricky to do that, given the fact that adaptation looks different in different parts of the world. And it should include indicators on finance and other means of implementation. So this is something that's really been missing from the discussions on the global goal on adaptation. There's really strong pushback from countries in the global north that don't want to talk about their responsibilities in terms of providing finance and support in terms of technology transfer or capacity building if it's sought, despite the fact that they have the historical responsibility for emissions. Next slide, please. I'm actually going to skip over this, but you can find more information in the submissions that are linked a little bit later if you would like to read it. In terms of where we're up to and what's happening in the next few months and where those opportunities might lie. Sorry for the slightly wonky formatting. And if you want more information on this, you can find the decision from Bonn back in June. But just concluded there have been submissions on which indicators are currently out there to support experts in mapping which indicators could already be tracked. There's been a call for recommendations of experts to parties and observers that could help in making a shortlist from those mappings. There'll be a workshop that's coming up in October that will cut across themes, and then there might even be additional thematic workshops. We've heard there might be one specifically on health, but the details aren't yet confirmed. And then there'll be a report by May 2025 with a list of new indicators that have come out of that mapping and refining process. Then following that, there'll be 2 final hybrid workshops for parties in the lead up to COP30 and a final decision at COP30. On the final slide, I don't need to walk us through it, but just to track the evolution of some of the health community's thinking around the global goal on adaptation over time. You can find the links to submissions there if you'd like to know more, and really, really happy to get in touch with anyone that would like to talk more. And really big thanks to some of Fiona's collaborators as well as the NDI for inputting in the first submission that's listed on the slide, and commendation to the NDI for their focused on neglected tropical diseases in their submission down the page. And that's it from me. I'm so sorry that we've run over, and really, really grateful to everyone for staying back.